So when we're looking at, the outpatient model, everything from outpatient ambulatory detox to IOP and OP, it really is set up to be able to be, the first stop for someone when they're either thinking about getting help or when they're going to resume back into, continue their care and go back into the community. So I think what better way, to help people to be in their community and treat them in the community. What I mean by that is, when you have someone that, whatever, through a consequence, with their family telling them they have an issue with alcoholism or drug addiction, it's you have to go away somewhere. You have to go to 30-day inpatient and then come back. And there's this expectation that, at least from the families I talk to, is if I send my loved one to rehab 30 days, they're going to come back cured, or they're going to come back completely different than when they went away. But the reality is that's just the start. So they're removed from alcohol and drugs. That's where you start to really uncover what the underlying issues are. And then they need treatment for that when they're back home. So for outpatient, we're starting that process from day one. We're treating them in the community. We're working with the families. We're working with the referral sources, with their support system in general, with their employer, and they're able to not put life on hold if possible. They're able to still be home with their children, their spouses, they're able to keep their job, and if possible, we get them started in treatment right away, and then also provide as many resources as we can while they're in our care. Of course, there's always going to be cases where somebody comes in and they're too acute to be treated at the ambulatory level of detox or an IOP level of care. And that's where having a place that is almost set up like a triage center, do a full evaluation with Dr. Savan and our medical staff, and then also meet with our therapist. And then we meet as a clinical team to find a higher level of care for them. What we usually have also seen with the 30-day inpatient treatment is there's a lot of ambivalence about whether a client should go or shouldn't go. And when they're talking to these places on the phone, it's too much of a commitment up front. So they have a million excuses why they can't walk away from their life, and some of them are legitimate, and other ones are just their way of trying to express their fear and why they are afraid to take a look at what's going on. So a defense mechanism. But if they are agreeable to come into this outpatient center first and complete the assessment, it seems like we're a little bit more able through motivational interviewing to work through their fears or the reasons for not going inpatient and then make that referral. So it's a way to capture more people, get them in front of a licensed provider, educate them on what's going on, look at what's going on from the medical model as well as the biopsychosocial through the therapist, and then provide them with as many options as possible.